everybody, welcome back. I hope you guys all had a nice week so far. Today I wanted to spend a little bit of time talking about perinatal mental health, which is basically the mental health of a woman during and after her pregnancy. This is a topic that I'm really passionate about. It's one of my specialties, and I really enjoy working with women during this stage of their life because there's just so much going on during this time. Some of it is really amazing and great, but other areas of it can be challenging. So this is one area that I just want to touch on so that everyone has a sense of what it is, what to look for, and how they can help if they know someone who might be going through it. Okay, so let's start with the prevalence. It's actually pretty prevalent. At least 1 in 7 women who are pregnant will experience some form of a perinatal mood disorder. So what that means is at least 1 in 7 women will either have significant symptoms of depression or anxiety or any kind of a mood dysregulation during or after their pregnancy. You guys might see this presented in different ways. I think the most popular one that people know about, because it's talked about most, is postpartum depression, and that is basically experiencing depressive symptoms after pregnancy. The thing with postpartum, most people might not know this, is any symptoms that come up, mood disorders, within the first year after you give birth is considered postpartum. So a lot of people have the impression that it needs to be right away, but that's not the case. A lot of people don't experience these emotions until 2, 3, 4 months down the line. So there's no timeline as to it has to happen right away. If anything, the first 2 weeks after birth, it's really normal to have a lot of emotions up and down because your hormones are basically shifting so dramatically during that time. So that's referred more to as the baby blues, and that's really common. 80% of women will experience that, but a lot of the time it will resolve on its own. But if it doesn't, that's when we're looking at some kind of a postpartum mood disorder, which, like I mentioned, postpartum depression is one. For that, you would be looking for a change in mood that's more depressed looking, appetite, changes in appetite, up or down, changes in sleep, which I know it's hard to gauge when you have a newborn, but difficulty sleeping or wanting to sleep all the time, those changes too. And with depression, a lot of the time, it's really just a change in your motivation, your energy, your view on life. If you're feeling hopeless, if you're feeling helpless, you don't have that drive to keep going. So those would fall under postpartum depression. But what a lot of people don't know about is that a lot of people will experience postpartum anxiety. So suddenly they'll start having panic attacks, or they'll start feeling anxious or worrying more or fearful about certain situations regarding their baby. Or they might not want anyone to touch them, or germs and all these things, which typically they're not an anxious person, but suddenly during or after the birth they find themselves being really anxious about situations where they might even have trouble falling asleep because their mind won't stop. They're thinking about all these potential scenarios of what can happen. Another thing that might come up is bipolar, which is basically extreme mood swings. So they're either suddenly feeling really depressed and no energy, or they're on top of the world and wanting to get everything done around the house, and and they are able to do it because they have that level of energy. But it's not one or the other, it's the fact that it cycles between both. So interestingly, for me, it was something that was interesting when I read about it, that actually 50% of bipolar diagnoses in women are diagnosed postpartum. So that's a pretty significant number, and I think a lot of the time, if you're had any kind of inclination towards it, the mood swings and everything, the hormones and everything going through your system, lack of sleep, all these things contribute postpartum to the actual manifestation of the bipolar. So those are the three big ones. However, there's postpartum PTSD, there's postpartum psychosis, there's a lot of areas that can be affected postpartum when it comes to your emotional and mental well-being. So being aware of it is the first step, and then after that, the next thing would be to educate so that you are aware of what to do if you have those symptoms or you know someone who has these symptoms. And the most important thing is get help. Ask the right questions, ask them how they're feeling, ask them if they're anxious, ask them if they're sad, ask them if they feel like their mood has changed since they had the baby. Sometimes if you don't ask directly, you'll never really get the truth. So I encourage you guys to just ask those scary questions because you might be changing someone's life by doing so. And if they do seem like they have some kind of a mood regulation issue going on at that point, then help them get help. So whether it means to see a psychologist, someone like myself, to work through those symptoms because they are very treatable, and getting the help they need that way, or going to a hospital that serves maternal wellness. A local one that I would recommend is Huntington Memorial. They have a great wellness program for mothers where they address all these issues. And a great website to refer to for help with maternal and postpartum issues would be Postpartum Support International. They specialize in this. They have a number that 24/7 you can call, and they can link you with therapists in your area and advice. They have online support groups that are free. There's a lot of help out there. So the first thing is recognize it, ask the right questions, and then, take the right steps to get the help that you need. If there's anything I can do to help, please feel free to message me, call me. If I can be helpful, I'd be more than happy to meet with you, or someone that you know and love and care about. Okay, so I hope you guys are having a nice day, and I hope that the rest of this weekend goes the same, and I look forward to checking in with you guys next week. Alright, thank you so much. Bye-bye.